Hello everybody and welcome to today's webinar on understanding and managing feelings of anger. My name is Charlotte Ford and I'm an educational psychologist who works for One Education in Manchester. Originally this was going to be a live training session, but due to the coronavirus pandemic and government guidelines, I was asked to adapt it to be a webinar. I sincerely hope it's a helpful and thought-provoking use of your time. On the slide, you'll see the aims of today's webinar, but before we start, I'd like to prompt you to be sure that you're in the right space and frame of mind to be listening today. There's been a lot going on, maybe professionally and personally, over the past 2 to 3 months, and a theme running throughout this webinar is how essential it is to look after yourself. Therefore, it's okay to opt out if you feel you need to. If you feel you're in the right headspace today to be thinking about this topic, then great. I'd encourage you to put your mobile phone somewhere that you can't see or hear it, because this will really help you to focus on the information and engage with the activities. So today I'm going to be supporting you to have an understanding of escalating and de-escalating feelings, such as anger. I'm going to use two models, the arousal cycle and the hand-brain model, developed by Dan Siegel, to talk through each phase and stage of how children and young people go from feeling calm to being at crisis point and to feeling calm again. At each stage, I'm going to speak about your well-being and what you might experience when supporting a young person, to share some strategies that you might use to help yourself and the students that you work with. I've designed this webinar with a wide range of needs in mind, so not all of the strategies will be appropriate for every young person. You know the young person, the situation and the school much better, and the strategies are suggestions of what might be helpful, but I'd encourage you to adapt and change them as you see fit. I'd like to encourage you to reflect and to apply today's learning throughout the webinar. So pause the webinar now and pick up a pen and a piece of paper. Think of a young person that you currently work with or have worked with who can feel angry in school. I'm going to prompt you to pause me and apply today's webinar throughout. But please do feel free to pause me at any point to have a think about yourself, the student that you're holding in mind, or a strategy that you might want to try when you next are supporting them. I'm also aware that it's really hard to listen for a long time, particularly when it's virtual. So I won't talk through everything on every slide. You might wish to pause or have a look at some of the slides at a later date to gather more ideas and support your reflection. But I'll aim to keep today's webinar to around 40 minutes, but obviously it will be longer depending on how long you pause for each activity. I wanted to start by thinking about the mental health or well-being of staff in school, i.e. how we're feeling on a daily basis. We've all experienced a lot of change, worries about our health, about our families, and change in schools due to the pandemic, so we might notice some stronger feelings in both staff and the pupils that we support. The psychological implications of reopening schools should not be underestimated, and it's really important to acknowledge our own feelings about returning to school life. We've all got individual circumstances and will be experiencing different emotions at this time. In the quote here, Bruce Perry is emphasising that during any normal situation, we have to think about our own regulation. That's our emotional regulation. But during a pandemic, it's even more important. So we need to check in, notice how we're feeling, and make sure that support is in place for us so that we're able to support the students. As I introduce you to a model and work through it with you, at each stage we're going to touch on your experiences, responses, and how you can look after yourself. So take a pause here and have a think about the first words that come to your mind when you think of anger. The things that I think of when I think of the word anger are that it's an instinctive feeling as opposed to a rational and reasoned response. Think of that fight, flight, or freeze response that we can often see in children and young people, and ourselves in some situations. I also think of it as a secondary emotion, so that Anger arises from a primary emotion such as fear, embarrassment, hurt. It's usually a defense to avoid those painful feelings and more vulnerable feelings. It could be a reflection of some emotional difficulties and a release of those pent up emotions. It's also an essential part of being human and a potentially useful emotion at times. It's a very normal part of life. This quote really spoke to me because it normalizes that we all feel angry sometimes and that's okay. In fact, it's quite adaptive in some situations. So the quote says that anyone can be angry, that's easy. But to be angry with the right person, to the right degree, at the right time, for the right purpose, and in the right way, this is not easy. The latter part of the quote, so where we're thinking about who we're angry with, how much, in what way, that requires really careful thought and planning. And that's not something that any of us are able to do when we're feeling angry. And that's something I'll talk about a little bit more with the hand brain model. There is a video clip on the screen here. I'm not able to play it through the webinar, but I'd really encourage you to take a couple of minutes to watch it. It's a scene, sorry, from the film called Dodgeball. In the scene, there's a man called Gordon who is playing dodgeball. He's the last one on the team, and his coach tells him that he needs to get angry in order to win. He sees his younger wife flirting with another chap in the audience, and this makes him feel really angry. This really helps fit with all of the previous definitions of anger. So it's extreme displeasure at seeing his wife flirting with another man. It's a release of those pent up emotions. He's not angry at all in any other part of the film. And it's also an instinctive feeling which he can't reason with. And it covers up more vulnerable feelings for Gordon. So if we look at this iceberg here, it shows that angry might be the behaviours and the feeling that we see in school, but actually underneath that are lots of more vulnerable and painful feelings. So for Gordon, there might be some fear of him losing his wife, some feelings of embarrassment, feelings of distrust, feeling tricked and rejected, or just really hurt and lonely possibly. So I've put this on here just to help us think about that often when we're angry, there are other emotions that are hidden under the surface. There are also some times in our lives where regulating our emotions is more difficult. And the question that I pose to you here is that why might difficulties related to anger emerge or increase during adolescence or on transition to secondary school? Just take a pause here and have a think about why those difficulties might emerge or increase for a couple of minutes. So adolescence brings a new set of worries and tasks to learn. Young people at this age are developing a new level of independence, they're experimenting with their identity, and unsurprisingly, any conflict or stress can often be to do with whether they feel they have enough control over their lives. And often what I'm seeing in the secondary schools which I work in at the minute, more so than before the COVID pandemic, is that children and young people are trying to exert even more control over their lives than I've seen previously. And I think that's very much related to the current situation and the lack of control that we all might feel. Understandably, for young people and teenagers, friendship groups become very important. So the need for acceptance and belonging becomes really essential, and it's more important than at other stages of childhood. This need can bring with it a lot of sensitivity. So this sensitivity, along with that emerging sense of identity and the hormonal changes of puberty, can increase those angry feelings and outbursts. Adolescence is also a time of accelerated brain development, which impacts on our behaviour and our emotions, which I'll touch on when I introduce you to Dan Siegel's hand-brain model. So as I said in the aims of today's webinar, the first model I'm going to introduce you to is the arousal cycle. This cycle can help us to understand how feelings of anxiety, stress, and anger can begin, escalate, and reduce in 5 stages. I'm also going to use the hand-brain model to help us understand what is happening in our brains at each stage to inform the strategies for the staff and for the students that you support. I've added another section to this cycle, which is the preventative staying calm stage. And again, I'll talk through that a little bit more in a few minutes. I should note that young people and adults can move through this cycle many times in the day and at any point. So that's why I really wanted to focus on your well-being during this webinar too. So take a pause and do a rough drawing of this cycle. It will be on the slides as we go through, but if you want to note down the names of the stages, then please feel free to. The second model which I'd like to introduce you to is the hand-brain model, and this was developed by a psychiatrist called Dr. Dan Siegel. He came up with the idea that we can use our hand to picture and demonstrate how the brain works, and I've used this many times with children and young people to help them understand this too. So there are 3 main parts to the brain, and I'd encourage you to hold up your hand and do this with me as I talk it through. So if we can see here, we've got the brainstem, which is represented here by the wrist. That controls the behaviours that we need to survive. So breathing, digestion, and movement might be some examples of that. The limbic system, which is represented here by our palm, is known as the emotional part of our brains. The main part of the emotional brain is the amygdala, and that here is represented by the thumb. That's responsible for those fight, flight, and freeze stress responses. I like to think of the amygdala as the jumpy superhero who is acting in a good way to try and keep us safe. So it has good intentions, but sometimes it might be a little too responsive. The cortex, which is represented here by our fingers, is known as the thinking part of our brains. It's responsible for those higher order thinking skills such as empathy, planning, reasoning, reflecting, and problem solving. So information comes in and is processed logically in that cortex. So I'm now going to talk about how the parts relate to one another. So in the first diagram, we've got the fingers that are overlapping that thumb and palm. So this represents that the emotional and thinking parts of the brain are working together. So the thumb and the fingers are connected. When this happens, our thinking brain is online and able to do all of those things that we just talked about in terms of reflecting and reasoning. Information comes in and is processed logically when our brain is working like this. I like to think of it as the thinking brain hugging the emotional brain to make it feel safe. In the second diagram, if we flip our fingers up, this is what happens in our brains when we're feeling stressed, dysregulated, overwhelmed, and the emotional and thinking parts of the brain are no longer working together. There's disconnection between the two parts. The emotional brain is in charge, it's hijacked the thinking brain, and logic no longer has an influence over our emotions. So we're responding instinctively in the moment. This is what Dan Siegel calls flipping our lids. As I touched on earlier, adolescence is a time where the brain is significantly growing and developing. So because that thinking brain, the thinking part of our brain, is still developing, teenagers rely much more on that amygdala, the thumb that was represented in that model, to make decisions and to solve problems. And they rely on that much more than we do as adults. Therefore, it's already harder for them to access the thinking part of their brain, and can be why rational decision making is much harder for them. So now I'd like to encourage you to work through the arousal cycle with me, bearing in mind a student that you have worked with or are currently supporting. So the first stage is the preventative staying calm stage. I feel this is a really important and essential part of the cycle, because the things we can do here reduce the likelihood of those emotions starting to escalate in the first place. At this stage, it's when the young people are feeling calm, ready to learn and ready to interact. So using your hand, Place your fingers over your thumb and palm to represent how those emotional and thinking parts of the brain are working together at this point. For some young people that we work with, for example, looked after children, they might already come into school feeling more anxious and unsettled than other children. So having these embedded preventative strategies as part of your daily practice are essential here to reduce the likelihood of further escalation. So for each stage, I'm going to talk about strategies for yourself and strategies for students. So you may have heard of adults being an emotional container before. Each adult and each student, everybody in fact, have their own emotional container. When students are not yet able to regulate their emotions, or if they're overwhelmed with their feelings because of their experiences and their circumstances, adults can use their emotional container to hold or relieve the student of some of those feelings. It's likely that you already do this, whether you realise it or not. Think about a day when you were calm and relaxed in the morning, but came home from work feeling very full, agitated, frustrated, sad, or even overexcited. It's likely that during the day you helped a student, a parent, or a colleague to manage their emotions by holding some of those feelings for them. If you regularly work with children who have social and emotional needs, you might often feel like this because they are very good at making you feel how they feel, because often what they really need is a safe, trusted adult to help contain their difficult thoughts and emotions. But in order to be an emotional container for others, we need to have space in that container. And at this early preventative stage, this is still really important. So have you taken time to think about how the pandemic has affected your mental health and emotional container? Do you need to put in some more time to think about your own physical and mental health? Take some time to ask yourself some of the questions on the screen now. Apologies in advance for the amount of words on the screen, but with it being a webinar, I wanted you to be able to access these strategies without necessarily needing to write them all down. So these are some ideas that we can use at the preventative stage, which in an ideal world, we'd have these embedded as part of our daily practice. The key message at this stage is to create and reinforce predictability, and that's primarily achieved through trusting relationships and consistent routines. So for example, we might have regular check-ins with students to kind of catch those emotions before they start escalating. We might meet and greet them at the start of the day to see how they've been that morning, the night before, anticipate any particular trickiness that day. We might support them through those transitions throughout the day so that they know what's happening, they know what to expect. Having regular communication with parents and carers at home, being proactive and balanced with that communication. Telling the child or the young person what you want them to do rather than what we don't want them to do. I'd encourage you to pause and reflect on which of these you already do and how consistently you do them in school, and whether there's anything that you'd like to try or have a go at in the next few days. We've spoken about the preventative staying calm stage, so now we're moving through to the noticing phase of the arousal cycle. Here, the young person has thoughts, so think of a running commentary going through their heads, and feelings in their body which raise their anxiety and their stress in response to situations that they see as threatening. Now, this is really important. So in our reality, there might not be a threat, but for them, it can feel very real. It might be that the triggers are internal or external. They might be slow burning, they might be immediate. So it could be a response to a task that they feel is too hard, a comment someone made the day before, not sleeping very well. As you can see on the cycle there, those feelings are starting to escalate. And you'll see that for each stage, I've included a photo of my hand to show what's happening in the brain. So take your hand to show that those fingers are just starting to come away from the thumb. So that amygdala, the parts are just beginning to disconnect. So some reason and logic can be accessed because they're not completely disconnected, but they're just beginning to. So can you pause and think of any triggers for the young people that you work with? So stage one is about the art of noticing. If we can notice these early signs in ourselves and our students, we can often help stop the feelings and behaviours escalating to crisis point. The key strategy here is to stop, be present, and notice. How am I feeling? Is a question throughout today's webinar, but it's a great first question to ask yourself in the moment. How am I feeling? How's my emotional container doing? Am I aware of myself so that I can respond calmly? You might notice that you're becoming agitated or annoyed by a behaviour that a student is doing. We're all individual and have different things that soothe and calm us, and equally that agitate and escalate us. The child's behaviour might be something that's soothing to them, and therefore it's meeting a need. So again, it's about thinking about what we can do to help ourselves cope with this behaviour, or encourage them to do something different but that still meets those needs. This stage can be so beneficial in building your relationship with the student, and that might help you to feel more positive and confident about your role in school. So can you help your student to notice and be present? Maybe you can empathise with them and link their emotion to their behaviour to help them understand it a little bit more. You might be able to model how they can regulate by showing them what helps you to feel calmer. So maybe a repetitive job, a walk, having a little laugh about something that's happening, noticing something nice outside. And it's about thinking about what you could do together that helps you to both feel calmer. So once we've checked in ourselves, we can then turn to the student. And first we need to know what to look out for. So each behaviour and trigger might not seem anything major at this point, but we need to notice and respond before they accumulate and escalate. So you had a think a couple of minutes ago about particular triggers that you might notice in the students that you support. But what tells you that they're starting to become dysregulated? Are they raising their voice? Are they very distractible? Are they a little withdrawn? Are they invading other people's personal space or interrupting? Are they avoiding tasks, saying no to more things? Or has their speech got faster? Have a think about what lets you know that that young person is starting to become anxious and stressed or angry. Stage two is about responding quickly. And this is when the body is preparing for a stress response, okay? So if we hold up our hands again, that thinking part of the brain is starting to come away a little bit more again from that emotion. That emotional brain is beginning to take charge. Adrenaline is released, muscles become tense, breathing becomes more rapid, and our blood pressure rises. As I touched on earlier, some young people might already come into school at this state. Hence why they seem to go from 0 to 100 in seconds. It doesn't take very much for them to flip their lid. And that's because they are coming in at an already heightened state. They're closer to flipping their lid than some of the other young people might be. So seemingly little things, which seem little to us, are very triggering for them. So I've called this stage responding quickly because the young person's emotions and feelings are starting to escalate. They might escalate slowly or quickly, and they might escalate even if you've tried the strategies to help them feel calm and ready to learn. You've been trying to stay present and notice their feelings. It's now really important to show them that you're listening, seeing, and caring for them by empathizing with them, validating how they're feeling, and helping them to understand why they might be feeling that way. In order to do this, we again need to know how we are feeling and responding. So the technique above can be used to help yourself or your student. So you might think to yourself, I'm feeling frustrated because my student is sad, they're struggling to do the work, their behaviour is difficult to manage. I need to feel and be calmer to help them feel calm. Maybe I can find an activity that will help us both feel a little more settled. For your student, you might say something like, I'm wondering if you're feeling sad because you're trying really hard, but the work is challenging. However, you can't rip your book or scribble on your work like that. I think we both might need to go for a little walk and come back when we're more ready to learn. Can you pause the webinar now to think of your own script that you might be able to use in that situation? Sometimes the behaviours and how young people respond can be difficult to manage, and it's okay that sometimes it's hard to stay calm. We are all only human. Another way of protecting yourself is to remember that the way the student is behaving is not personal. They're communicating a need and an emotion. And remember that we tend to show our true feelings with those we feel safest with because we know that they'll be there for us no matter what. Sometimes as well, we don't have enough space in our emotional containers and we need help. This is also okay. You can ask for support to help the child, or they might need to work with someone else for the rest of that lesson or the rest of that day. So try and think about who you might go to in school who could support you when you're feeling that you need that. So at stage 2, again, we're thinking about how to help the young person feel calmer. Everybody is different, so you'll know what would be most appropriate and most helpful for the students that you're working with. Again, I'd encourage you to pause and reflect on which of these you have tried in school, what you might like to try a little bit more consistently, or anything new that you might like to try over the next few days. In the third phase, we're in crisis point and unable to think clearly. So use your hand to show that the lid has flipped. Okay, the fingers and the thumb, so that's the thinking and emotional part of our brains, are disconnected and the emotional brain is in charge. At this stage, safety has to be the priority. Because that thinking brain is offline, asking why, placing demands, and requiring them to empathize is really impossible because that thinking brain is offline. So this stage is all about calming that crisis. And that starts with us calming any escalating emotions that we're experiencing. It's very likely that you're feeling how the student is feeling, so you might also feel a little in crisis. So ask yourself again, how am I feeling? It's easy to feel worried about how other people see you during a student's crisis, or if you lack confidence in your skills to manage in the moment. Remember that you will always be doing your best with the skills you have and the space you have in your emotional container. Take some time now to note down the skills you have to calm a student in crisis, and if there's any ways that you can remind yourself of those in the moment. Again, sometimes a child or a young person needs another adult in a crisis, so it's helpful to check again. Am I the right person? Do they need somebody different? Sometimes a change of face is exactly what a young person needs. It might seem a little odd to take some time for you during a crisis, but it also might help to take 15 seconds up to a minute to do an activity that helps to ground you and feel more relaxed. You might try something like a breathing technique. So an example on the screen there is box breathing. That's where we breathe in for 4, hold for 4, breathe out for 4, and hold for 4. And we can repeat that a couple of times. We could also try some grounding activities. So thinking about all of your toes, the arch of your foot, the heels touching the floor inside your shoe, and you might push them into the floor and then relax them, doing that quite slowly. You might also visualize yourself in your favorite calming space, or you might do something like moving and releasing tension. So to breathe in and lift your shoulders, and then breathe out to let them relax back down. These strategies are all very inconspicuous calming techniques that also might help in the moment. Or equally, you might like to try and do them with the student if they're responsive to that and able to do that alongside you. So at this stage, we're focusing back on the student, and that's why we need a pre-agreed plan so that we can help every adult to be consistent and informed and to feel as though they are managing. So remember, at this stage, the thinking brain is offline, so reasoning and logic aren't possible. The most important things here are around making things safe, and that might mean removing other young people rather than the student that's feeling overwhelmed, and really reflecting on and being aware of our body language, how we're appearing to them, listening and ensuring that they feel heard, and using de-escalating phrases and words to try and affirm how they might be feeling. Again, I'd encourage you to pause here and have a think about which of these strategies you do well, and if there's any little ones that you might like to try in the next few days. Stage 4 is about recovery for all. And in the fourth phase, the feelings start to settle, but we can be easily triggered and set off again. So if we look here, we can see how the hand moves up and down between connection and disconnection. Think back to that anger iceberg that I showed you earlier. Beneath the feelings of anger were emotions and feelings of vulnerability, shame, guilt, confusion, disappointment, all of which young people are likely to feel after a crisis, even if it doesn't seem obvious. These feelings in themselves can feel quite threatening and can then trigger another crisis. So again, that reasoning and the thinking parts of our brain aren't quite back online, or definitely not consistently. So we need to make sure that there's not too much demand for them at that point. So you got through the crisis and we're now in the recovery stage. This stage will differ in length depending on your experience, the student's experiences, that day, that week, or that month. And you might have noticed these cycles happening more and more during the COVID-19 crisis, or it might have meant that the adaptations in school have helped the student to manage a little bit better. At this stage, we again need to ask ourselves, how are we feeling? How can I meet my own needs at this stage? How can I still be present, notice, and empathise? And these are some questions on the slide that you might want to consider. The recovery for all stage is another stage that can be used to build and strengthen your relationship with the student through mending any hurt, through activities that are calming, soothing, and caring. So think about what strategies you like and enjoy that help you to relax after a stressful experience. You might be thinking of a glass of wine or beer, which won't be so helpful in this situation, but maybe a hot drink together, spending some time outside, doing some breathing, sharing and talking about nice memories together. That might help you both to process the experience and settle yourselves. Students can be really vulnerable after a serious incident, and often we can want to jump in and know why something happened, often coming from a place of helping. But if we push this too soon, it can trigger another crisis. So the main principles here are to help the young person feel settled and calm. We can do this by avoiding provocative questions, avoiding asking why, allowing time for theirs and our recovery, offering nurture such as something to eat or a glass of water, and guiding them towards a calming activity. And again, I just encourage you to take a pause here and reflect on some of the strategies for yourselves and for the students. Stage 5 is about recuperating needs, and this is when the body needs time to recover and rest. This can take up to 90 minutes after a serious incident for the body to return to normal. So as the thinking and emotional brain are now working together again, the thinking brain is hugging that emotional brain and making it feel safe. It means the thinking brain is back online, and this is the time for reflection and continued repair. So you might notice that at this stage, we've put the student strategies before the staff strategies. And this is because it's likely that your recuperating time will need to come later, whereas the other stages required you to really focus on yourself first in order to respond. This stage is likely to require some time away from the student so that you can focus on that recuperation. However, it can still be a time to rebuild and mend any relational breakdowns. We talked through a technique earlier that helps you to validate emotions without accepting the behaviour, and this could also be a useful technique to use now. Restorative practices are not just a set of questions, but a process whereby the adult's behaviour is key. So think about how the room is set up, your body language, your tone of voice, your hopes for that conversation. For example, walking and talking with the student might be better than sitting across from a desk. I'd leave at least 15 minutes to have a restorative conversation with a young person and have a glass of water or a drink, both for them and for you. So, some key questions which might structure that conversation might be: can you tell me what happened? Can you tell me how you were feeling? Who has been affected and how might they be feeling? What thoughts were going through your heads? What do we need to do to make things right? Being a young person's container is tiring. So ask yourself again, how am I feeling? Am I full up? What can I do to debrief, separate myself from their emotions and let go of them because I don't need to keep them in my container anymore? At this stage, it might be helpful to think about a cup of tea and a chat with a colleague. Sharing with others will help you to reconnect with yourself and others and feel heard and cared for. A walk outside might be useful to reconnect with yourself and notice where you are. You might need to have some food. Your energy levels might be low after dealing with a crisis because your hormones have been helping you to manage that situation. Be kind to yourself. After a situation, we can often think about what went wrong. While it's good to reflect and learn from our practice, it's also helpful to notice what helped you, what helped the student, and think about how you can do that again next time. There might be some self-care that you need to do when you get home. So having a bath, getting some fresh air, a hug from a close relative. These are all things that are really important to think about that self-care and your well-being. So the aims of today's session were to understand the phases and stages of escalating and de-escalating emotions, such as anger, using the arousal cycle and linking this to Dan Siegel's hand-brain model. I hope that by working through the arousal cycle with a student in mind, you've been able to reflect on what might be happening in each stage for the student and for yourself, as well as what you might do to support yourself and the student in each stage. I hope that a key takeaway message from this webinar is the importance of looking after yourself. This is not selfish, but a necessary part of supporting others. Think about when you get on an aeroplane and the air host and hostesses say to you that you need to put your oxygen mask on first before you can help others. That's exactly what we need to do when we're supporting children and young people in school. Thank you for taking the time to listen and reflect with me today. My final question for you is to think about how you might share your learning today with colleagues or students that you work with, and any next steps that you might do for yourself or your student. And finally, I'd just like to pop up some helpful links or some signposting in case you want to do any further reading or looking into this. I'd also really appreciate you taking a couple of minutes to provide any feedback on this webinar. So you can use the camera function on a phone or an iPad or similar device, and you can use the camera to scan your device over that code. It will bring up a really quick SurveyMonkey questionnaire that will encourage you to give some feedback about the webinar, both what was helpful and what could have been better. I'd really, really appreciate you taking the time to do this because it really helps us to know how to support you. So thanks again for taking some of your valuable time to think with me today about this topic, and I wish you all the best. Take care.